Hi everyone, I'm Marina Villaro Capellan, and together with Jorge Fernández Trillo, Elvira de la Peña, Felix Viana and Ana Gomis, we made this paper called Piezo2 Mediates Mechanical Sensitivity and Injury-Induced Hypersensitivity in MRGPRD expressing nociceptors. We made it at the Instituto de Neurosciences in San Juan de Alicante, Spain, and I hope you all like this explanation. Approximately 20% of the global population suffers from chronic pain. Among its symptoms, pain in response to mechanical stimuli is one of the most common and disabling, but still the molecular mechanisms underlying mechanical pain remain unclear. In this study, we have focused on a subpopulation of DRG sensory neurons considered C-fiber nociceptors and defined by the expression of MRGPRD. These neurons, as you can see in the image, innervate the skin and are particularly involved in the detection of mechanical stimuli both under physiological conditions and in pathological pain states. The majority of MRGPRD neurons co-express the mechanotransducer piezo2. In this paper, our aim is first to decipher what is the function of piezo2 in these nociceptive neurons, and second, using the chronic constriction mouse model to study if it's required in mechanical hyperalgesia induced by nerve injury. We first wanted to check the degree of co-expression in these nociceptors by doing a RNA-scope. As you can see on the graph, almost 80% of MRGPRD positive neurons in magenta co-express piezo2 in green. Then, in order to study the implications of piezo in mechanosensitivity, we developed a conditional knockout exclusively in these neurons. And looking at the graph below, you will notice that piezo2 transcripts were reduced to a 30%. Here on panel B, you can see representative traces from cultured DRG neurons showing the typical rapidly, intermediately, and slowly adapting mechanically activated currents. In control MRGPRD neurons, shown in panel C, we observe a mixed population of responses with a substantial proportion of rapidly adapted currents, which are classically associated with piezo2 activity. However, when selectively deleting piezo2 in these neurons, as shown in panel D, mechanically activated currents are essentially abolished. Most neurons become non-responsive, and together these data indicate that piezo2 is the main channel mediating mechanically activated currents in MRGPRD expressing neurons. But now what happens with piezo2 under peripheral nerve injury? To assess whether it has some role in mechanical hypersensitivity, we used the chronic constriction injury model, also called CCI. In panel A, we can see the experimental timeline. We first induced piezo2 deletion in MRGPRD expressing neurons using tamoxifen, and then performed CCI on the sciatic nerve. The behavioral testing was carried out before and after injury, and here we can see in panels B and C that we showed the mechanical sensitivity measures done with the bone-free filaments. First, we used a low-intensity filament. We can see it in panel B, and we saw no differences in mechanical sensitization between sham and CCA mice. But then in panel C, we can see that using a higher intensity filament, wild-type mice, we can see them in blue, display a clear increase in paw withdrawal frequency after CCI, and this is consistent with mechanical hypersensitivity. In contrast, in the right part of the panel C, we can see in red and orange that mice lacking piezo2 in MRGPRD positive neurons show a reduced hypersensitive response. So these results suggest that piezo2 contributes to the development of mechanical hypersensitivity following nerve injury. To directly assess the contribution of piezo2 to mechanical hypersensitivity in vivo, we performed calcium imaging in MRGPRD expressing DRG neurons. And here we can see that high intensity, in fact noxious stimuli, elicit robust responses. Taking a deeper look into the amplitude analysis of these calcium imaging experiments, we can see that both for the pressure and the alligator clip, the high-intensity stimuli, the wild-type mice show an increase in the amplitude of the response after CCI, And this difference in amplitude between the sham and the CCI is not present in the knockout for piezo2. So this can indicate that mechanical hypersensitivity in MRGPRD nociceptors during peripheral neuropathy critically depends on piezo2. If we check out panel E, analyzing the percentage of responder cells, we can see for the high-intensity noxious stimuli that, curiously, comparing the sham conditions between wild-type and knockout, there's a decrease in the percentage of responders in the case of the knockout for piezo2. So this indicates that piezo2 may have a role in acute noxious responses by MRGPRD positive neurons. When analyzing the morphology of the fibers, we can appreciate that when comparing the wild type with the knockout, a significant reduction in dermal axonal bundles. This indicates that piezo2 might play a role in the organization and distribution of MRGPRD fibers. Finally, to sum up with some conclusions and implications of piezo2, our work demonstrated that it's highly expressed in nociceptors, that it has a role in acute nociception, and finally that it's crucial for the development of mechanical hyperalgesia.